Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked question. Tell me about your med school, or tell me about your experience during med school. So in order to answer this question, it's better to let the interviewer know the strengths of our med school instead of the weakness of our med school. So you definitely don't want to let them think that you are trained in a very bad med school. So just focus on those strengths, ignore those weaknesses, and you can talk about your clinical training and all your research experience during med school. And if you have a specific experience to share, that is definitely a great idea. So actually, you can show your unique character to share those stories with your interviewer. For example, if you join a research team and you are the leader, you can definitely talk about that to show your leadership or teamwork to your interviewer. And at the end of your story, you can tell the interviewer that you are trained in a very good medical school. Therefore, you are very prepared for continue your clinical training in their program. So now I'm going to give you my example. So, okay, Dr. Cui, can you tell me your experience during your med school, or tell me about your med school? Yeah, of course. So my med school actually is in my hometown, which is the best med school over there. And the program I joined is a 6-year bilingual program. We learn medicine in both Chinese and English. In the first year, we learn medical English and basic science, including medical physics, chemistry, and advanced mathematics. From second to fourth year, we learned medical scientific courses and other clinical related courses. And we did a clerkship and internship in the last 2 years. During clinical rotation, we were allowed to perform many procedures, including joint arterial and venous blood, folic acid replacement, and bone marrow biopsy, as well as other simple procedures. We are also allowed to assist a nocturnalist doctors in night shift to take care of the patient. Therefore, my med school is a university-based clinical centered teaching school, and I was trained, and I had a very solid training when I was in med school. Therefore, I think I should be ready to continue my clinical training and in your program. So that's why I'm here. You can see that in my answer, and I give the interviewer a whole picture of my med school, and I talk about what courses I joined, and what clinical training I had, and also what kind of procedure I learned during med school. And also I told the interviewer that during this training I should be ready. I had a very solid clinical training. I should be ready to match to their program. So which covered almost all of the points I mentioned above. And because actually I have a lot of another story to show my character, like the leadership teamwork. So I don't want to mention about it here. And also actually it's a very lower chance for the interviewer to ask me this question because I'm a very old IMG. So that's why I want to give you some idea of my idea for answer this question. So you can definitely talk more about your specific share your specific experience with your interviewer if you have. So I hope you will do well during the interview. So good luck.